Okay, so as I reflect the skin, you can see the superficial fascia has also been removed. And after removing the deep fascia, we can see this
Trapezius.
triangular muscle. Actually, it is one half of the muscle, the other half is present on the other side. So, if we take this muscle as a whole, it has this type of shape. The upper origin I told you from the superior nuchal lines, external occipital protuberance, the nuchal ligament, then from the vertebra prominence to the T12, the spine of the T12 vertebra. All right. So now I have cut this muscle along its origin from the C7 to the T12. From the C7 and T12 I have cut, and now I am reflecting this muscle trapezius. So as I reflect this muscle trapezius, you can see where its fibers are inserting. This bony prominence, you are seeing this is the spine of the scapula. This region is this triangular region. This is the root of the spine. So this is the spine. This is the root of the spine. Above this root of the spine, you have the insertion of a muscle which elevates the scapula. That is the levator scapula. So, students, this muscle which you are seeing, this is the levator scapula. Now, at the root of the spine, you can see another muscle taking insertion. So, this muscle is the rhomboid minor. Then below the root of the spine, along the medial border of the scapula, you can see this large muscle, the rhomboid major. So this is the rhomboid major, the rhomboid minor, and the levator scapulae. So these muscles, you can see, they are coming from the axial skeleton and attaching to the appendicular skeleton. Few books they call them as the superficial muscles, few books write them as the intermediate muscles. So if I cut along this insertion of the trapezius, all right. So see, I am removing the trapezius along its insertion. You can see it is attached to the upper lip of the spine of this scapula. Actually, students, if I tell you, I have already told you about the origin of the trapezius. Insertion, what happens? The upper fibers, they are going and they insert onto the inner border of the lateral end of the clavicle. The middle fibers, the fibers you can see here, the middle fiber, they are running transversely. The upper fibers, they were running in a downward direction. Whereas the lower fibers, you can see direction of fibers, it is running in a upward direction.
Upward.
So upper fibers running downwards, middle fibers running transverse direction, whereas the lower fibers, they are running in a upward direction. Now these fibers, the upper fibers, they are inserting onto the posterior border of the lateral end of the clavicle. These transverse fibers, they are inserting onto the medial surface of the acromioclavicular joint. ठीक है, here you have the acromioclavicular joint. So here, this is the acromioclavicular joint. So medial surface of the acromioclavicular joint, you can see these fibers inserting. Then these lower fibers, they are inserting onto the upper lip of this scapula. Upper lip of the scapula. So this is how this large trapezoid muscle is originating and inserting. As I remove this, you can see above the scapula, you have this muscle known as the supraspinatus. This supraspinatus is filling the supraspinous fossa. Below you have the infraspinatus. This muscle is the infraspinatus. Now students, what will you identify this muscle as?
Deltoid.
So this muscle is the posterior fibers of the deltoid. You can see this is the lower lip. This is the lower lip of the spine of the scapula. Here you can see this is the spine and you can see the lower lip. So along the lower lip of the spine of the scapula, you have the attachment of the posterior fibers of the deltoid. Similarly, here you have the acromioclavicular joint. From the lateral aspect of the acromioclavicular joint, you have the middle fibers of the deltoid. These middle fibers are forming the major contour of our shoulder joint. You have the anterior fibers. Where they are coming from? They are coming from the anterior border of the lateral end of the clavicle. Apart from that, I showed you these muscles, the rhomboid major, rhomboid minor, levator, scapulae. All right. Okay. Now, students, this is the supraspinatus, infraspinatus. Here you have the deltoid. This is the spine of the scapula, upper lip. lower lip. Along the upper lip, you have the insertion of the trapezius. Along the lower lip, you have the origin of the deltoid. Where the deltoid is going to insert? Deltoid tuberosity present on the lateral aspect of the humerus. Coming to this region, here you have the further deep muscles. Here the fascia. Here the fascia has not been removed. Below this, you have the group of muscles known as the erector spinae muscles. All right, so we'll see them afterwards. But what is important for you now to identify, which is the triangle of auscultation. So for that, we have to reflect the skin here. So this skin I have reflected now. So students, you can see another broad muscle in this region, this muscle. You can see this entire muscle is a single muscle having a large origin. This entire muscle, it is the latissimus dorsi. So students, if you see, if I place it properly, its origin is much higher. So this is actually how the muscles are arranged. This is the trapezius, which inserts onto the 12th spine of the 12th thoracic vertebra. And here you have the latissimus dorsi, which is originating from the P7, spine of the 7th thoracic vertebra. It is then taking origin all along this spine, and also you can see this condensed fascia. This region, this fascia, it is known as the thoracolumbar fascia. This thoracolumbar fascia, you can identify it is looking shiny, aponeurotic, and it is also a modification of the deep fascia. So from the thoracolumbar fascia, then again you can find another bony ridge, which is known as the iliac crest. So along the iliac crest also you can see the fibers originating. And where they are going to insert? So students, if you see, they are moving upward and anterior and laterally. Upwards, anterolaterally. They are moving. Here you can see at the inferior angle of the scapula. Few fibers are originating and they are also joining this muscle. Now they are together blending and it twists around and goes and inserts where? Just show here how the fibers are twisting around now. It is going and twisting around and inserting onto the floor of the bicipital groove. At the floor of the bicipital groove. So students, this is the large muscle which is the latissimus dorsi. Now if I again place back the trapezius. So can you tell me which is the triangle of auscultation? So in front of your eyes you can see this. This region is the triangle of auscultation. So this region is known as the triangle of auscultation. You can see this region is devoid of any superficial muscles. You have only the intercostal muscles. So when a patient comes, if you place your stethoscope at this site, you can hear the lung sound. Here you can see one half of the trapezius muscle. We have already discussed about it. And if I reflect this muscle, you can clearly see a large nerve coming and innervating this muscle. So what is this nerve? This is the spinal accessory nerve, which provides the motor supply to the trapezius. Now, as you can see, here you have the supraspinatus muscle. Here you have the infraspinatus muscle. Now, coming to the shoulder joint. Here you can see this is the deltoid muscle, the posterior fibers of deltoid and the middle fibers of deltoid. Now an incision has been given along the origin of this muscle and now it has been reflected. Now as we reflect the deltoid, we can see large number of nerves innervating this muscle. So these nerve fibers innervating this muscle belong to the axillary nerve. So if we trace, we can find the axillary nerve is present here. So this structure is the axillary nerve. Along with it, we can see some blood vessels. These blood vessels are the posterior circumflex humeral blood vessels. Now students, as you know, the axillary nerve and the circumflex humeral blood vessels, they wind around the surgical neck of the humerus. Hence this site is the surgical neck of humerus. Now students, I also want to show you one thing. This muscle, the infraspinatus, you can see as it approaches the shoulder joint, it has become membranous. Similarly, as you see, this muscle, the supraspinatus, it is also becoming membranous as it approaches the shoulder joint. As well as here you can see this muscle, this is the teres minor. The teres minor also becoming membranous. So these muscle, the supraspinatus, infraspinatus, teres minor, and another muscle which is present on the ventral aspect of the scapula, that is the subscapularis. Together they form this sheet-like structure which blends with the fibrous capsule of the shoulder joint. So this structure is known as the rotator cuff of the shoulder joint, which helps in stabilization of the shoulder joint. Now, students, let's move on to the different spaces in the scapular region. Now, first you have to identify this is the scapula. This is the medial border. This is the lateral border. So along the lateral border, inferiorly, we have this large muscle known as the teres major. Above it, we have the muscle which is known as the teres minor. So this is the teres minor. Here you have the teres major. Now this muscle is the long head of the triceps, and here we have the shaft of the humerus. So these muscles, they cross each other to form the quadrangular space, the triangular spaces. So here we can see from the quadrangular space, these structures are moving from the anterior to posterior region. We have the axillary nerve and the circumflex humeral vessels. Now coming to this lower triangular region, we have two important structures, the radial nerve and the profunda brachii artery. This profunda brachii artery is the deep branch of the axillary artery, and it comes behind and provides the blood supply to the posterior compartment of the arm. And as you can see, the radial nerve is piercing through the triceps muscle. It supplies the muscles of the posterior compartment of the arm, the forearm, as well as the palm or hand. Now students, this is the upper triangular region. So in this we have a single structure which is the circumflex humeral artery, which needs some further dissection. So here we can see this circumflex. So students, as I reflect the latissimus dorsi, we can see the deep muscles of the back, the erector spiny group of muscles. They consist of the iliocostalis, the semispinalis, and other muscles. What I want to show you is the origin of the muscles of the abdomen. So anterior abdominal wall, as we know, it has the muscles, the external oblique, internal oblique, and the transversus abdominis. Out of these, the two muscles, external and internal oblique, are taking origin from this iliac crest. So this layer with the fibers running down, vertically down, this is the external oblique layer. As this muscle moves forward, the fibers will be running in a direction inferior and medial, that is hands in the pocket direction. Below this you can see this layer which is the internal oblique muscle. Here you can see these muscle fibers are running upwards and laterally, and as they move forwards they will move upwards and medially, that is in the